We're live now, Facebook family. Here we are again, another Monday. Pops Barnes Health and Community Tips for the Weekend. Yes, for any of you who may be watching us new, we're on every Monday morning from 10 to 10:30. A little bit late this morning, but at 10:02. But I'm always here along with our community partners, New Horizons Community Health and Trio Life Health Services. And so I'm going to always, and we have a special guest here, Miss Pat Fry, Home for Good. We're so glad she's going to give us some really good information this morning. And you know, we do this program because the Bible says my people perish for lack of knowledge. And you want some, this program is set up so that we can give you really good information as I try to turn this phone off here without ringing. On me, there we go. Good health information so that you can live a long and good quality of life with your loved ones. And community information, really good information for you to know, like Pat is going to give for Home for Good. And so I always introduce our community partners. I'm going to start with the lady with the glasses, Miss Susan Gallagher.
Good morning. Happy New Year, Facebook friends and family, and welcome to another episode of Live with Pops Barnes. Thank you, Pops, for making this possible. New Horizons Behavioral Health serves 8 counties in West Central Georgia for the behavioral health, addictive disease, and developmental disability needs for adults, children, and families. And just so glad we can be here and share some great information about resources available for our community, whatever your needs may be.
And we're also gifted every week to have Dr. Nikita Pitts representing Dr. Lowell Client from Trio Life. And Dr. Pitts, would you introduce yourself and say a little bit about Trio Life?
Yes, good morning, everyone. I'm here for Pastor Lowell Client. We are Tree of Life Healthcare, located at 1968 North Avenue, right across from the Columbus Research Institute and the parking lot of Piedmont Hospital. Fairly small building, you might miss it, but that is our address. Our number is 606-225-0355. And we're a faith-based organization. We serve on the shore. So give us a call and get you services, references that we might not offer. Thank you.
These two organizations, Trio Life Healthcare and New Horizons Behavioral Health, two organizations that I've known and worked with for goodness since I became an RN. They provide services for individuals who don't have any health care, mental health care, or physical health care. And so we decided to partner together and come every week to let you know, give you some health information that we know definitely will benefit you, and community information that we know would also benefit you as well. And it's our joy. And we have what's called edutainment. In other words, we educate you, but we cut up too. We have a whole bunch of fun with y'all. And so now today, we have Miss Pat Fry, a longstanding friend of mine, and who is the director of Home for Good. And Pat, would you let everyone know a little bit about yourself? And then we can get started on our presentation.
Well, thank you. Thank you, Pop, Susan, and Dr. Pitts, and for having me. And Happy New Year to everyone. Hopefully everyone is entered the new year happy and healthy and wanting to hopefully finally close that chapter known as 2020 and move into new and a better year. Home for Good is a program of the United Way of the Chattahoochee Valley. Like New Horizons, we serve a large county area. We actually serve 8 counties in Georgia and Alabama. We serve Russell County in Alabama, as well as 7 counties in Georgia. And Home for Good, we are tasked with implementing the city's plan to end homelessness. And when we say end homelessness, that means we want to make homelessness brief, rare, and one time, so that if someone enters or becomes homeless, that the goal is to rapidly rehouse that person and or household within 30 days, and to put wraparound services in place so that it doesn't happen again. We've seen a large increase in the amount of prevention we've done over the past couple years, and that's truly where the goal is to make make prevention available for households and families so that homelessness doesn't happen. But we'll talk about that on another day. We got some things to talk about today when it comes to our point in time count. But thank you for having me.
And let me tell you something, Pat. Susan brought up a good point. Because of the things that Congress is deliberating on now, we're going to try to see if we can get you back here for an update on the issue of the, not vouchers, the issue of the, help me out here with the
Evictions.
with the evictions. So that's extremely important for a lot of people. So we're going to see if we can have you come, if we don't have anyone slated, or maybe have you come on prior to our presentation of our program. Take about 5 or 10 minutes. We can do that. I think we can do that. This is because this is our show, and we can do that. Can't we add a little bit of time, Susan? Can we add about 10, 15
You are
minutes?
the executive producer. Whatever you want us to do will happen.
No, Susan, you are the producer. No, you're the executive producer. That's what you are. You're the executive producer. So if you say it's okay, we can get started. Okay, so Pat, you have an excellent presentation here. And so I'm going to just pass the baton to you and just let you get started.
All righty. Hang on one second. Let me go ahead and share my screen here. And come on, where are we? All right. Like I said, we're going to talk today about our point in time count, or as we affectionately call it, our PIT count. Unfortunately, whenever you're dealing with federal regulations and or programs, there's lots and lots of acronyms. But our PIT count, or point in time count, is something we do each year to assess who is experiencing homelessness in an area and to get some additional information on them and access to services.
And Pat, if you haven't difficulty showing it, just read it. You're doing an excellent job. I mean, just cover, as long as you cover the material.
You're seeing the screen because I hit share.
Bingo.
Yeah, we're seeing the screen.
Okay, great. Perfect. Okay, so the point in time count, like I said, is a literal count of all of those experiencing homelessness on any single night in a community. And when we say count, we don't, we mean that literally, but not in the fact where you just go, well, 1, 2, 3, and are just actually just counting heads. This is not that. This is literally interacting with individuals and families who are experiencing homelessness, whether they be in a shelter or unsheltered. And we'll go into what the details of that mean in just a few minutes. On a given night that normally takes place in the last 10 days of January. And that's a federal mandate that this year actually has been waived for those dates because of some issues with safety and some concerns with after the holiday surge. And we'll talk about what we're going to do in our community. But we are going to have a count, and but we're going to do things a little bit later than we normally would. This point in time count is literally a snapshot. It doesn't tell you how many people and or families have accessed homeless services over the past year, whatever. It's literally a snapshot of that particular day. And doing it in the same time period every year allows you to have a gauge as to what your community is looking like as far as numbers, and then breaking down those numbers into, are we seeing an increase in children experiencing homelessness? Are we seeing an increase in men experiencing homelessness, or other demographic kinds of information? Again, for the purpose of the point in time count, we rely on the Department of Housing, Urban and Development's definition of homeless. And the definition is also broken down into two sub-definitions or subcategories. meaning the unsheltered homeless, those who don't have a primary nighttime residence, and are staying in a place that's not meant for human habitation, in a car, in a park, outside, someplace under a bridge, in a shed, any of the places that are not meant for folks to be living in, and they don't have access to running water and utilities, those kinds of things. And then we have the sheltered individuals experiencing homelessness who are staying in a shelter or in a hotel that is being paid for by an agency providing homeless services. And we do this.
Pat,
I'm sorry, yes, sir.
I'm glad that you're breaking this down because I've told a number of people many years ago I was homeless, actually on 3 different occasions. And the best place that we were at, besides staying in doorways in LA, was living with friends. We would live with friends 2 days this time that we moved. So that is still considered, correct me if I'm correct, that itself also comes under that shelter definition. Is that right?
No, sir. No, sir. If you're living with family or friends, according to the HUD definition, you are not homeless. But if you can only stay there for a period of time that is less than 14 days, you could be under the next category, which would be at risk.
I got you. Thank you for that. I appreciate that.
Sure, but for the purposes of the point in time count, those are not considered.
I got you.
Like I said earlier, when we're counting these numbers, we're not talking about everybody who came in or out or accessed services during the year. That we do on a monthly basis in our reporting to the city. And those individuals, those are living with family and friends, those who are at risk, those are absolutely counted. That's where we get into what we talked about earlier. That's where we get into the prevention part.
Gotcha.
Let's let you not end up on the street in the doorway. What do we need to do to intervene in that meantime?
I got you.
Okay. But again, in the point in time count, the sheltered count covers those who are in emergency shelters throughout our community, or using hotel motel vouchers, meaning it's being paid for by an agency. Those who are in transitional housing, or those who are in safe havens. We don't have safe havens in the state of Georgia, but we have to include that in the definition because it's a federal mandate. So we, rather than take any shortcuts, we put everything in there as it comes from the Federal Register. The unsheltered, again, like I said, is a car, park, abandoned building, train station, bus, airport, parking lot, under bridges, and everything in between. And unfortunately, people make assumptions because of what someone looks like, or where they may be hanging out, or where they may be sitting on a bench or whatever, about whether someone is homeless or not. And I know I'm getting ahead of myself because it's probably later in this presentation, but we don't make an assumption about anybody when we're doing our count. As I said, we don't go and say, yep, there's 5 people there. 1, 2, 3, 4. Okay, put 5 check marks. We do a complete survey. It's about 17 questions that get to the root of who's out there, what are their needs, and who can we refer them to get assistance, to include access to permanent housing.
That's awesome.
We're not making assumptions about anyone. Because, and in fact, our staff and I, we were talking about this earlier today. It's interesting to see when someone says, well, I saw this person, and you say, oh, yes, well, that was the college student who is paying to live in the dorm down the street, who was just dropped off by his parents and is walking back to his dorm with his suitcase. And someone made an assumption and wanted to go and talk to this person. So that's really dangerous. So when we do the point in time count, we monitor and measure the trends. Like I'm saying, we get to see what we look like on our local level and our national levels. And I'm going to be frank. What we look at is how are we doing here? You know, what we do here affects the folks here. We make local decisions. We make local program decisions. We like to make local funding decisions. Excuse me, based on what our numbers look like here, because every community is different. And to compare us to, you know, what, you know, Columbus, Ohio is as crazy as comparing us to Los Angeles or anything else.
Right.
We have to look at our data and know what works for us. And the fact that we can use that data to really, really make decisions, to have programs that literally change their focus because of where the numbers were going. We've had a shelter in the last couple of years that had for decades been a single male focused shelter. And in May of 2019, they changed their model to serve families because we saw an uptick in families.
Right.
So it's giving us information. And of course, it's to comply with our federal regulations and requirements, because all of this information is reported to Congress as part of the annual housing assessment that goes to Congress about end of May or beginning of June, not long before they go on their 4th of July recess every year.
Okay.
And again, talking about what
Pat, just to interject something here, I'm really so happy that a study like this is being done, because then it accurately assesses the state of homelessness, not only here in Columbus but everywhere.
Yes,
and
sir.
so this is definitely, and I know that when you were appointed to the United Way for Home for Good, a lot of these measures really came into effect. So I know you had to hit the ground running in order to implement a lot of this here. So I just want to give you a little bit of credit where credit is due. Thank you for all the work that you've done since you've been in your position.
I appreciate that. Thank you. But like I said, we normally every year since the point in time count has been done, which dates back to the early 2000s, it's been mandated to do it in the last 10 days of January. And typically, it's because it's the coldest time of the year across the country, and because it's the coldest, more people in shelter.
Right.
So you get a more accurate count, and it's easier to find people. When it's warm and pretty outside, you know, spring and fall in Georgia, people are stepping out. So it really is easier to find people, and you can do it in a smaller area. Although, as I said, our for the purposes of the point in time count, we survey Muskogee and Russell County. Russell County being a very, you think Muskogee County is big, Russell County is huge. So we will have, and we do have surveyors that are down in the Hatchachubby area, believe it or not. So we're going all over the place. So it's a vast geographical area that we cover for this. But again, the purpose of this for us is not just to get numbers, but truly is to assess the needs of the clients that are experiencing homelessness, and how do we make those referrals to permanent housing. Temporary housing if we can, but then into permanent housing. And as I said earlier, we do brief interviews with those who are experiencing homelessness. About 3 years ago, we started using a digital app that we use tablets or phones for. That once it's submitted, the information is stored in a data warehouse that we literally see moment by moment updates, like little dots on the map of the surveys that are happening. We have, at the end of the time of the point in time count, we can have preliminary data with deduplication, again, preliminary data within 4 to 6 hours, when it used to be 4 to 6 weeks.
I mean, so you can actually quickly collect all of the various demographic information.
Yes, yes, yes. So we'll have a pretty, it's a margin of error from the preliminary report that we do each year to the final report. It's a margin of error of less than 1%.
Oh,
So so yeah, the deduplication, and that's one of the reasons that we went with that. And again, because the less you have people touching the information, the more clean the data is. So we've made some investments in that over the year, and it's really helped us out on that. As I said, this year we will be doing our count a little bit later than normal. In November, the Department of Housing and Urban Development, or HUD, gave each community the option to apply for a waiver. You could apply for a waiver to change the way you do your count, which they call the methodology. You could apply for a waiver on the date you conduct your count, so it didn't have to be in those last 10 days of January as always mandated. Or you could apply for a waiver not to do the count at all. As much as I would like to think that when we're said, well, if you don't do a count and you get a waiver, that, you know, we're not going to hold it against you in subsequent information or in subsequent applications. You know, I've never been one to not do all the work, and I don't think our community is a community where we want to take the easy way out. So we said, you know what, we know it's going to be different. We know it's going to be a little bit tougher, but we still want to do the count because there is no way to know where we are as a community.
Exactly.
And we need to go unless we do the work.
Exactly.
So
Exactly.
our Continuum of Care board voted to move the count about 3 weeks. We were going to do it the week, excuse me, of January the 25th. We are moving it to the week of February the 16th. Actually, it's February the 15th through 19th is that week. That is President's Day on that Monday the 15th. So we'll be doing our count on the 16th and 17th. Our shelter count, or where we actually go into the shelters, will be on the night of the 16th. We will start, excuse me, we'll start about 5:30 that afternoon, and we will wrap up about 9 o'clock that night in the shelters. We will be back at it at 5 o'clock the next morning, doing our unsheltered count and finding where folks spent the night last night to make sure that we've accounted for everyone in our community who is experiencing homelessness. It makes for a long couple of days, but as I said, by late on the 17th, early on the 18th, we will have preliminary numbers for what it looks like in our community.
And
I went
Pat,
ahead.
let me ask a question.
Yes, sir.
I know this requires people. So are you, I mean, how, if someone wanted to assist you, I mean, tell me how this is done.
Yep.
Do you request volunteers
Absolutely.
early on of individuals who have done it before, or is there some, if a person wants to, is there any kind of training or procedure that if a person wants to really actually help out? Because you want to know something, I'm going to be honest with you. That's a lot to accomplish in 2 days. And I know it has to be rigorous. And so I know that you even have a number of people who have kindly, in the past, volunteered their time. But
Right.
how is something like this done? How do you get enough personnel to actually go out and do something like this here?
And I'm glad you said that. And we do rely heavily on volunteers. On any given year, we've had anywhere from 45 to 60 volunteers who participated. And those are unique individuals, many of them who volunteered for both counts, whether it be the nighttime count and the morning count. But we have volunteers from organizations across the community, New Horizons, you know, excuse me, House of Time, Open Door, and I'm going to leave people out, so I'm going to stop right there. But across the community, we have volunteers. We have many of our city officials. In fact, our our mayor's chief of staff, Richard Bishop, joined us last year for the point in time count. We have many other just community-minded volunteers that are not connected with a particular agency who come out and work with us. And this year we're going to be partnering with the Medical Reserve Corps to help us out in volunteering to do the
that's
point.
awesome. That's awesome. I know you had to use a number of committed volunteers, because I'm telling you, that's those 2 days, I know it's concentrated effort in doing the council. I'm just so glad that, and one thing I like about this community is a volunteer community. You have a lot of good-hearted people that will come out of the woodwork just to lend a hand when they see a need. And so I'm just so glad that you have a number of committed volunteers.
And you are exactly right, because there are volunteers. I've been, on January the 1st, I was my 5-year anniversary with the United Way, and I started doing point in time count 2 years before I came on board. So for 7 years now, there are some of the volunteers, and again, I'm not talking about volunteers who volunteer as part of their job. These are community volunteers who are not connected, truly are not getting paid to show up. Definitely not getting paid to show up at 5 o'clock in the morning when it's 25 degrees.
Right.
They have been here every year, and they literally start calling me the first week of January. When do you need me? When do you need me? That's what Columbus does. That's what Columbus does. Columbus has the heart to serve people. So it's just one of those things that make you go, okay, I don't mind getting up and going to work every day, because these are the kind of people that help it all make happen. Yeah.
Those are the types of people you hit the nail on the proverbial head. Columbus is full of a lot of giving, really good individuals. And so I'm just so happy, but I knew that you had to rely on a lot of really good, tremendous volunteers in order to be able to do the work that you're doing. So my hat goes off to them. And I in advance tell you, please convey my sincere thanks for their servant.
Right. And
volunteers.
I have, and I don't know if we can, we will be sharing this presentation on our United Way and our Home for Good Facebook page and on our website. But at any time, if someone wants to volunteer, get information or whatever, they can always email me. Email's always the best way to get me. That way, because it'll be there, and I always go back and check and make sure that I've responded to each one of them. But it's simply Pat at UnitedWayOfTheCV.org, and we would love to have anyone join us. There is extensive training, like you said, Pops. We've been doing virtual training for 2 years already. So prior to COVID, we had that pretty much solidified. And so we have volunteer training and those kinds of things, and all of our quote unquote forms and our authorizations and our privacy and confidentiality forms, and all of those things our forms are electronic and able to be signed without having to print anything out or having to come into close contact with anybody. So we're ready and excited about what the numbers are going to look like this year.
Now, Pat, before we go to the questions and answers, and if Susan or Dr. Pitts or any of our viewers want to type in, what do you call it, Susan? That chat line
box. Right. I don't see anything in the chat right now, though.
I do have. I have a question. First, a statement. So I'm going to see, you're going to be coming back with some important information concerning the rent extension. Is that correct?
Yes, sir. I'm going to go ahead and stop sharing the screen so I can see who I'm talking to. And there we go. But yes, we have, as many of your viewers may know, back in September, an eviction moratorium for non-payment of rent was implemented by the Centers for Disease Control. And that means that if you follow the steps outlined in the very long directive issued by the CDC, you would qualify for being allowed to stay in your home without paying rent until the expiration of the moratorium or you received assistance. The key of that is there was a declaration form that had to be filled out, signed by you, excuse me, and delivered to your landlord. Well, that was due to expire at midnight on December the 31st. It was extended to January the 31st at midnight. However, it's not been fully vetted and implemented through the Federal Register. So there's a lot of things right now with Congress just coming back from holiday that's sort of in flux. We are desperately, in fact, when we were getting on earlier, I was trying to read through and get up to date with some things, and nothing has been updated since December the 30th. So we're all just sitting and waiting. So I'd love the opportunity to come back and discuss that.
And we're going to make that. We're going to make that happen, Pat, because that seriously impacts a lot of individuals nationwide, and particularly specifically here in Columbus. And so we're going to make that happen. Let me ask you, in the same vein, how would a person, because I know there are a lot of individuals who are caught up in that, talk us through where do they go? Now, we're talking about individuals that may not have access to the computers. We're talking about individuals that may not even know that this exists, who are caught up in a situation like that. Can you talk me through? Because if you can talk through it, you can talk through that every person. How would what's the first steps? What's the steps I would take when I'm under the threat of being evicted? What do I do? Where do I go? If I don't have a computer, what do I do?
You pick up your phone and you call 211.
Bingo.
Now,
Thank God for
if you have
211.
If you have a prepaid phone, you probably need to dial the 10-digit number, because with prepaid phones, 211 sometimes connects you weirdly because of the
I
prepaid.
see.
So that number is 706-405-4775.
Okay.
If you call 211 and say, I'm facing eviction, I'm behind on my rent, I need a place to stay, those operators will then take you through and get you the referrals to where you need to be, which you may end up being referred right here. But it's going to be based on your family's unique situation. Because it's not a one size fits all. And that's the one thing, and Pops, I could go on for hours talking about it, but that's one of those wonderful aspects of 211 is that because of the standardized questions, those operators can then look at the answers and make a referral that's specifically designed to meet the needs of you and your unique situation.
Yes. Yeah, and Pat, you're so right on that. Would you give that number again, please, for our viewing audience?
Yes. The 10-digit number to reach 211 is 706-405-4775.
Thank you so much, Pat. And Pat, we are going to have you come back. I would just want you to let me know. I will schedule you, if we could even just schedule you at the top of our programming, just so you can give that information out and any other information that you may have that would be vitally important, because that's the purpose of our show to begin with. So now I'm going to pass the ball to Dr. Pitts and to Susan, being that this is question and answer time, if they have any questions.
Pat has
Thank you.
disappeared. Pat? I think we've lost her connection.
But you know what you can do? You can still ask the question, because it's probably something that a lot of people will want to know. And then guess what? When we get Pat back, then what we will do, we will
All
have
right.
that question answered.
It sounds great.
Yeah. Okay.
And
one thing I
Your
was
question, go ahead, Dr. Pitts.
sorry. One thing I wanted to ask her was, in looking at those numbers from the graphs, where, and I don't have it in front of me, but the numbers for children, if there was a breakdown between the ages, or at least, you have children most likely within a family unit, but also
Sure.
like children who are aging out of the foster care system, if there was anything accounted for those numbers in that, cohort of ages for kids aging out of the foster care system, if that was accounted for, if they've noticed that. If there were no plans for those children aging out, how many of them, might have experienced
Well,
homelessness.
Dr.
And
Pitts, that is an excellent question.
yeah,
And I know that,
uh-huh.
I didn't mean, go ahead.
Oh, no, I'm sorry. And also, I just wanted to find out from Pat, what type of maybe resistance that she or the volunteers may experience when they're going out, especially to the unsheltered community of folks. Because, again, they're not in any type of building. And I'm thinking, could there be, or if any, resistance to people answering questions? They're already in a vulnerable state, and
Right.
to come and, in a sense, for some of them, feel like they're being invaded upon. Yes,
Yes.
it's a public space, but yet they're there. And I think, the mindset that, yes, I'm here, it may be public, but this is kind of like my domain. And for various reasons, especially mental health reasons, people are in situations, and just again wanted to find out what type of resistance, if any, that she and the volunteers, from approaching people,
Right.
especially those in unsheltered
Uh,
areas.
th-
I'll tell
Those
you,
are two excellent, good questions. And
I've
Susan?
been a volunteer in the past with the point in time count, and usually what we do is we have items to give away to individuals to participate in the count. There's usually some kind of toiletry items, snacks, bottled water, etc., so that if they do participate in the count, we give them something to thank them for their time. And I haven't, as a volunteer on both the sheltered in the evening and the unsheltered where we go out physically in the morning, I haven't come across anybody that was resistant or didn't want to share. If we found them and told them we were doing the point in time count and had a bag of items for them for participating, most individuals were glad to share their information, to share their story. People want to tell their stories.
Okay.
Yeah.
So you want to, those are three excellent questions that we can, I know, Susan, that you can let Pat know, because I know you're going to get together with her, those three questions. So we'll have those, because I'm willing to bet you, on our viewing audience, we have individuals who want to ask those same questions. And now next week, we are going to have Ms. Cheryl Johnson, Southwest Georgia Cancer Coalition. And every second Monday of the month, we're going to have Ms. Cheryl Johnson or a representative come on this show to talk about cancer. We're living in a very marvelous age right now, the age of technology that allows so much information to get out. When I was growing up, the word cancer was cancer. No one wanted to speak about it. Now, because of research, it is not a death sentence. And it's so important to have that type of information given out to our community for many individuals who are battling cancer, that they will have hope and that they know that so much is being done. And it's also a vehicle for us on this program to say, just like the two organizations, Tree of Life Healthcare and New Horizons Behavioral Health, two organizations that do so much in the community, they cannot help you in the community without your help. Okay, Pops, what do you mean? Well, you want to know something? We just got finished talking about volunteerism. Those two organizations can use volunteers. Everybody can do something. Everybody has an ability. And so you can volunteer. And then, of course, if your heart moves you and you have the needs, those are individuals that you can contribute money to, knowing that that money is going to be working for the community. And that's why I partner with these two marvelous organizations represented this morning by Dr. Nikita Pitts and Ms. Susan Gallagher. And now, Susan, if you will give your contact information.
Sure.
And Dr. Pitts, I know if you will also give yours. And Dr. Pitts, something, you're also in Alabama as well as Georgia here as well. You cover a big catchment area as well. And so, Susan, would you give your contact information?
Sure. If you find yourself in need of an appointment for mental health, substance use disorder services, reach out to New Horizons. Our appointment number is 706-596-5500. And we are currently offering telehealth and telemedicine options. So be sure to make sure to take care of your mental health during this time of COVID and use those telehealth and telemedicine options. Again, 706-596-5500.
And Dr. Pitts?
Okay, yes. And again, Tree of Life, we are located at 1968 North Avenue in Columbus, right across from the Columbus Research Institute and the parking lot, really, of Piedmont Hospital. Our number is 706-225-0355. If you have no insurance or if you're underinsured in some ways, give us a call. Also, the Association of Sickle Cell, that office is located within the Tree of Life building. So, folks with sickle cell or have needs regarding sickle cell or questions, you can also call us and we can refer you to the sickle cell office.
And that's awesome. And Dr. Pitts, we're going to be having Ms. Lois Williams come on, and I'm thinking on the 18th, I'm going to have to get with my executive producer, Ms. Susan Gallagher, on this here and find out what our scheduling is. We're having so many people that want to come on the program because they're really good-hearted organizations in this community that really want to let you, our viewing audience here on Pop Barnes Health and Community Facebook for the week, tips for the week, to get the information out. And so we're going to try to get Ms. Lois Williams, the Sickle Cell Association, to come out and talk about sickle cell. A lot of people don't know about sickle cell and just how painful something like that can be. So, Facebook family, as always, from my breakfast table, it's so comforting to be coming to you. I look forward to it. And in the interim, till we come again, I always say, please be good and kind to yourself because God loves you. Bye-bye now. Bye, y'all.
Bye. Thank you.
Thank you.
Thank you.
And I'm trying to find there we go, the button to go off.